Hi, my name is Jennifer Wittick. I'm a physical therapist. A physical therapist works with patients in helping them to regain mobility and independence after an injury or an illness. Much of my time as a therapist is spent working with patients on transfers. By a transfer, I mean just moving from one surface to another. This could be from a bed to a wheelchair, from a wheelchair to a commode, from a wheelchair to a toilet. But transfers are very important, and as a caregiver, you also will spend much time helping patients to do transfers. And that's why this particular video is on different types of transfer techniques and different types of transfers that can be used depending on the patient's abilities. Now, it wouldn't be right to do a transfer video without talking about body mechanics. So even though you've probably heard this many times, it's very important to have good body mechanics when you're transferring or lifting patients. By body mechanics, I mean that the way that you position and use your body to perform a movement or an activity is very important for not straining your back and for keeping yourself healthy and safe, as well as your patient. For body mechanics, there's many things involved, but I'm basically just going to review 4 important things for you. Now I'd like to just demonstrate for you a few of those body mechanics that are very important when you're transferring a patient. Number 1 is to make sure that you keep your feet apart. You want to have a wide base of support because that's where you're going to get your most balance and stability when you're transferring somebody. Secondly, you want to make sure that when you lift an object that you bend your knees and keep your back straight. When you bend your knees, that helps you to use your stronger leg muscles to do the work. And when you keep your back straight, it helps to prevent you from using the weaker back muscles to do the work. Third, you want to remember to keep the object or the weight close to you. If it's out here, you can see how you're having to strain and flex and bend your back, and that puts strain on it. If you keep the object close, you're keeping it right in with your center of gravity and making the job easier. And finally, and very importantly, remember that when you transfer a patient, you always want to keep your feet pointed in the direction of the weight. So if I start out with the transfer this way, I don't ever want to do a twisting motion where the weight ends up over here and my feet are pointed that way. Many injuries happen when it's a twisting type injury, and I know that sometimes it seems quicker and faster to just transfer a patient like that and think you're going to do one quick movement, but it's really not worth it because back injuries, remember, can last a lifetime, can put an end to this type of a career. So take really good care of your back and just make sure that you're always thinking about what position you're in and the type of position that you're placing your equipment in. You don't want to be in awkward positions. You want to allow for as much space around you as possible when you're doing a transfer. If you use good body mechanics, you should be able to perform these transfers often and with good safety. And just remember, if you hear some lessons on body mechanics and back care again, just be patient because repetition in this area is very, very important. Next, I'd like to just quickly mention a few safety considerations during transfers. You need to always be aware of what your patient's abilities are before you transfer them or their disabilities. You also need to have any equipment, supplies, or any assistance that you need ready for the transfer before you get there and actually start transferring the patient. If they need a certain chair adjusted, if they need certain shoes or clothing on, make sure that you've got that so you don't have to leave the patient midway through a transfer and grab extra supplies. Always inspect your equipment. When you go in, do a quick inspection and make sure that the wheelchair brakes actually work and that when you get your patient into the chair, it's not going to slide away from underneath them. Make sure if you're doing some type of a mechanical lift transfer that the sling isn't ripped or torn. Just kind of do a visual inspection and make sure things are working properly. With transfers, you also want to make sure that you have your surfaces as level and even as possible. That's good safety for yourself and your patient. You won't have to work extra hard to get them up onto a bed from a lower chair or onto a commode where you haven't properly adjusted the legs. So check to make sure surfaces are level as much as possible. Wheelchairs always need to be locked. That's very important. As a therapist, that's been ingrained in me, and I know sometimes when I go into a facility, they tend to put the wheelchair up against the patient's bed when they're napping or resting, and if I'm in there working with them, I'm always clicking those brakes on, and I know that sometimes the caregivers come in and they might be a little annoyed because they're always trying to move the chair and it's always locked, and I'm sure they know that it's me who's been there, but that's important. I would just say lock them and get in a habit of doing that. If that patient for some reason would get up confused or try to get into their chair from bed, it may not be safe having them do that, but you can't always prevent that, and at least if the chair is locked, it's not going to scoot away and they won't end up on the floor in the process. Also be aware that if you're transferring a patient into another chair that's not a wheelchair and that doesn't have brakes, if at all possible, push that chair up against a wall or a secure surface so that when they transfer into that chair, a lot of times they will lean back against it, put their weight against it, or many times they kind of plop into the chair. And if it's not firmly or securely against a surface, the chair can slide away also. Leg rests and arm rests, it's important to be aware of those. Arm rests don't always need to be removed, but in certain transfers they will need to be. Leg rests, almost 100% of the time, will need to be removed. It's usually a good idea. There's no reason to have a leg rest on when you're trying to move a patient. They just get in the way and cause some safety concerns. Make sure that the patient has the proper clothing they need, that they have shoes on and not slippers, that their shoes are not high heels or slippery flats. Just make sure they've got something there that has some kind of a non-skid sole that won't slide out from them when you're transferring them. And as far as clothes, that they have clothes that are not dragging when you get them up. Be aware that a lot of these patients have been ill for a while. Sometimes you will find that your patient, the only pants that this gentleman has are 4 sizes too big because he's been ill and he's lost a lot of weight. And when you put these on him when he's in bed, you may not realize it. And the minute he stands up, they're around his ankles. So not safe and not very comfortable for the patient when that happens. You'll have to just make adjustments for that. Maybe put a belt around them a little tighter. Make sure that they're secure. And I'd like to also mention that holds true for the Depends garments or the Depends diapers that patients wear. Too many times I've been walking behind somebody in a hall and seeing one of these residents walking, and as their Depends is shimmying down their hips and down their legs, and then to their surprise and everyone else's, around their ankles. They're usually very embarrassed, and it's something that can be prevented. When they were transferred into their chair, it only takes a second to make sure that those are on securely. If the tapes are loose, put a new pair on that's going to have tapes that will adhere and stay on the patient. And finally, for considerations, remember to always explain to your patient what you're doing with them. Make sure that you're telling them why you're there, who you are. Reminders are fine. These people don't mind that you tell them repeatedly what you're doing or remind them who you are. Many times they've forgotten from time to time anyway. So the reminder is very helpful and it's reassuring to them. As you transfer them, tell them each step of the way what you're doing, and make sure that you ask for their help so that they feel useful and needed, and also that you're encouraging them to use the abilities that they have. Now, I would like to show you some techniques of some types of transfers, and I'd like to actually demonstrate some of these transfers for you. There's just a couple of different techniques I'd like you to be aware of for bed mobility when you're moving a patient in bed. When you need to roll a patient to the side, make sure that you roll using their joints of their knee, hip, shoulder. Instead of rolling them as a log, you'll find it much easier if you can get them to assist by reaching to the opposite side, either to the bed rail or to the side of the bed. Have them bend up the leg closest to you or the leg opposite of the direction they're rolling, and then have them roll, and you can assist at the shoulder and the hip. Okay, same thing coming back. They would just shift over and bend up the opposite knee. You would explain to them to help reach across the bed, and you'd help roll this way. Also, just to be aware of, if you need your patient to lift up in bed so that you can position sheets, help them to move up in bed, be aware that you can have them bend their knees up. And we had mentioned earlier that you can raise the foot of the bed up so that gravity can assist. But this way, if their knees are bent up, they can help with a push. Sometimes there's a trapeze that hangs over the bed, and they can grab a hold of that and help with a pull. Many times all you need to do is explain to the patient you need them to lift up as if you're putting a bedpan under them. They'll understand what that means. Okay? Very good. And that way it's easy for them to shift side to side or for you to rearrange or position things. There's also times when you may not have another caregiver to assist you, and if you can get the patient into this position before you need to move them forward or towards the head of the bed, then if you can cradle near their knees and help up near their shoulders, they can push with their legs to give you some assistance with that movement. What I'd like to show you now is something that's called dangling. Dangling is usually an intermediate step that's used between the patient being bedbound for a long period of time and when they will get up and start moving around. The reason that dangling is important is because a lot of times if somebody has had surgery and they haven't been sitting up, they need to be in an upright position to help with circulation, to help prevent blood clots. Also, many elderly people are on high blood pressure medications. And what happens is the circulation system needs time to adjust between positions and movements. So what you would do if you have an order to dangle a patient is that you need to make sure when you come in that first you explain to them what you're doing. Be very sure to reassure them, tell them that you'll stay right with them, and that they need to sit up on the edge of the bed for a short period of time. Make sure that your patient is properly clothed so that they have on a robe or a bathrobe so they're covered when they're sitting. Once they're up, you may want to put a blanket around them or over their legs. With dangling, you want the bed in the lowest position, and to assist with that patient coming to a sitting position, you'll use the electric bed. I just want to mention, prior to getting them up, you will want to take their pulse. You'll need to be taking their pulse before, during, and after the dangling time period. So take their pulse, reassure them, explain to them, and then we'll bring the patient into a sitting position. Okay, now the bed can be assisting with this movement. It's also kind of a slow way to ease them into the sitting position. Once they're up enough in bed, I would explain to the patient, Mrs. Jones, I'd like you to try to get your legs over the edge of the bed now, and just turn yourself and sit on the edge of the bed. And because these patients may be weak, you'll probably want to put a pillow or two behind their back to support them. Always stay with your patient while you're doing this, and you need to observe how they're looking, anything that they're saying about how they're feeling. When the patient is in this position, you'll have them just do some leg movements and explain to them, I just want you to swing your legs a little bit in front of you, swinging their legs, moving their ankles, their toes, just getting some movement. And then I'll be observing if my patient is getting very pale, or if she's saying that I feel dizzy, or I have more pain than I had when I was laying down. These are all things that would give me a cue that I really need to lay that patient back down and then report those things to the nurse. But if Mrs. Jones is doing fine, then I let her sit and dangle for whatever the prescribed amount of time was that I was told to dangle my patient. And when she's dangling, I'll take her pulse for a second time and record that. And when we're done with that, then I'll tell her we can go ahead and lay back down. So I'll move the pillows back up so that they're in position, and then just explain, Mrs. Jones, if you can get your legs back up into bed. I'll lower you back down to a lying position. Okay, now I'll lower the bed back down so that my patient can return to a lying down position in a slow, comfortable way. I've positioned the pillows under her head so that she's comfortable. And when your patient is done with dangling, don't forget you want to take the pulse for a third time so that you can get the before, the during, and the after pulse. When you're all done with that, make sure that you record how long you had the patient dangle, what the 3 pulse readings were, and any observations or comments that the patient made while they were dangling. And then those things would be reported to the nurse. So just so you're aware that that's what dangling means, and there will be many times that you will probably be asked by either the nurse, the physician, or the therapist to dangle your patient. I'd like to now demonstrate to you a one-person pivot transfer. This is a type of transfer that you will probably use very frequently. What you need to be aware of with this type of a transfer, as some of the safety issues we talked about before, you need to make sure that you've got what you need in the room, that you've got your safety belt. Make a quick visual inspection of your wheelchair or whatever surface you're transferring your patient to. Make sure that the brakes work on it and the leg rests swing away, just to make kind of an inspection to make sure things are prepared for your transfer. With a one-person pivot transfer, if your patient is lying in bed, you'll need to help explain to them that you're going to get them onto the edge of the bed and then transfer from the bed to a wheelchair. So I would explain, Mrs. Jones, what I'd like you to do is roll to your side. So I want you to bring your knee up, roll this way. I won't let you come off the edge of the bed. Now bring your legs over the edge of the bed. And I would like you to push with your hand and your elbow into a sitting position. And this way I can help her from a sideline position into sitting. It's much safer for their back, and it's usually a much easier way to get your patient from lying down to sitting up. Now, I'm aware of Mrs. Jones's diagnosis because I made sure I read the chart or talked to the nurse prior. I know that Mrs. Jones had a stroke and that it made her left side weaker. So she does not have a lot of use of her left arm or her left leg. Mrs. Jones has fairly good trunk control, so she can maintain her sitting balance. Don't forget to use the transfer belt. The transfer belt has one side that does have teeth on it, if you can see the teeth, and one side that's simply another loop for the belt to go through. You want to make sure that when you place the transfer belt on your client that you're going through the teeth side first. Explain to her that this is just a belt for her safety and that you won't make it too tight. It does need to be snug, but make sure that you still can put your hands, some fingers behind it so that it's not too tight for them. If you have extra, you can tuck that in under the belt on the side so that it's not in your way. Now, what I'd like to do is I make sure that the bed is in a proper height so that my patient can get her feet flat on the floor. And what I'd like to have you remember is that when you have a patient who's got one side that's stronger, you need to always transfer to that stronger side. Now with Mrs. Jones, her right side is stronger, so I'm going to position the wheelchair parallel to the bed on her stronger side. Before I move the wheelchair over, I'm going to swing away and remove the leg rest so that it's not in my way. And I'll do the same on the other side. I'll position the wheelchair so that it's in an appropriate spot for Mrs. Jones so she doesn't have to do too much of a turn during this pivot transfer. Make sure that you lock the brakes. So the chair is secure. And all I'm doing is explaining to Mrs. Jones exactly what I want her to do and how the transfer will be completed. So I would say to my patient, I'd like you to please move forward in bed if you're able. If she cannot do that, you can help by doing a little bit of a scooching motion with the safety belt. Now that she's on the edge of the bed, I make sure that her feet are under her. If she's got a weak leg, I want to block that with my knee so that that leg is not collapsing out on her. So block the weak side with your knee. Sometimes you'll need to also block the foot a little bit so it doesn't slide. What I would explain to her is that on the count of 3, I'm going to help her to come to a stand. And notice I'm trying to use good body mechanics, bending my knees, keeping my back straight. And when I would bring her to a stand, I'm going to ask her to reach with her good arm, with her strong arm, towards the arm of the wheelchair to help with the transfer. Okay, push up from the bed now so that you've got a surface to help and push from. If this arm was not useful at all, I would just she'd either have it in a sling, or I may ask her to tuck it into her pocket during this transfer so it's not hanging and irritating the joint. And then on the count of 3, I'll have you push up and we'll turn and sit. 1, 2, 3. And then I would remind my patient that they need to reach back for the arm of the chair and lower themselves slowly as I help them. Now when I want to get my patient back into bed, I just need to be aware that if she had a side that was stronger, I can't arrange the chair the same way it was when she came from the bed to the chair. I would need to take the wheelchair and bring it around to the other side so that when she's going from the chair back to the bed, she's again leading with her stronger side. That's very important to remember. You can see that the patient is now sitting in a commode. A commode is just a portable toilet that's used at the bedside when the patient isn't able to get to the bathroom. I'd like to show you a transfer from the commode back to the bed, and for this transfer I'm going to use the pivot disc that we talked about earlier. Just to keep in mind, a commode generally has adjustable legs, so you want to make sure that prior to transferring your patient, like we talked about getting the surfaces level, you adjust the commode so that it's at a proper height that your patient can put her feet flat on the floor and still not have to go up a large distance to get to the bed. The commode is positioned just like the wheelchair was, parallel with the bed, so that she only needs to do a quarter of a turn during the pivot. What I'm going to do, this pivot disc that I briefly showed earlier, is just placed underneath my patient's feet, and this disc works fairly easily and it will accommodate up to 300 pounds. All you do with this disc is make sure that you explain to your patient you will be helping them with this transfer. It only is to help their feet swivel while you transfer them. Her feet are placed securely on the pivot disc, and I'll do the same type of transfer I did earlier. I would ask my patient to scoot forward on the commode, and that at the count of 3, I want her to push from the arms of the commode and assist with coming to a stand while I help to transfer her back to the bed. I'm assuming now that she has equal strength in both legs. This isn't a patient that had one side weaker or stronger than the other. So I just need to be there to generally help with the come to a stand and the turn to sit. Okay, on the count of 3, I'm going to have you push from the commode, and as you get up, I'd like you to reach for the bed when you sit. 1, 2, 3. And hopefully you could see how that pivot disc just worked under her feet to swivel her so that she didn't need to worry about the lower part of her body. Now normally I would be right in front of that patient securely with the gait belt, the transfer belt, and helping her with that. But for the sake of the camera so that you could see, I was standing slightly off to the side. That's how a pivot disc is used, and you may find times that you will need to use that with a patient. But in general, it's the same type of transfer as any one-person pivot transfer. The type of transfer we'll demonstrate for you now is called a two-person assist transfer. Use this transfer when the patient is too heavy or the lift is going to be too awkward for you to do on your own. Then you would need to enlist the help of another caregiver. And what we're going to do is basically a pivot transfer, but there will be one of us on either side of the patient. I want to point out that during all of these transfers, you need to have the patient keep their hands in a position where they can assist with the transfer. Even if they aren't really going to do a good job at pushing, still cue them to keep their hands there and to reach for the other surface. That way it keeps their hands off of you. It's very unsafe if they're trying to reach around your neck or around your waist. If they start to fall, you're going to fall with them. It can throw you off balance, and it's hard on your joints too if you have somebody hanging on your neck. So you need to remind them to keep their hands where they are helping with the transfer and then reaching for the opposite surface. What we're going to do now is transfer our patient, the two of us, from the wheelchair to the bed. We'll each stand on a side of the patient. Our hands will be one in the front and one near the side and the back. And we will stand so that our feet will pivot easily as we move this patient onto the bed. Okay, we'd have our patient scoot forward in the chair, make sure that her feet are bent, or her knees are bent and her feet are flat on the floor. And then one of us would count on 3 and pivot the patient to the bed. 1, 2, 3. And that type of a transfer works well when you just need somebody on the other side to assist you. The type of transfer I'd like to show you next is called a sliding board transfer. This transfer is used when the patient is unable to bear weight or when they are physically unable to get up on their feet for some reason. They do need to have good upper body control and fairly good upper arm strength. A sliding board is simply just a piece of wood or plastic sometimes that's used to bridge the gap between two surfaces that you're transferring between. This sliding board is tapered on the ends to make the transfer a little bit easier. When you use a sliding board, you need to make sure that you have a wheelchair that has removable armrests. And you want to make sure that you get that armrest closest to the patient removed prior to the transfer. Now I've already got the patient in a sitting position. I have a safety belt on her. And I'd like to ask my patient to just adjust herself a little bit so that she's scooted almost in a quarter of a turn. So I'll get her in that position just to make the slide a little bit easier. With the sliding board, all I'm doing is asking her to shift her weight to the opposite side, and I place the sliding board underneath one side of her hip. Now you can see that it's spanning that gap. I make sure that the chair is in a good position and that the chair is locked so that it won't scoot away from us. And then I'll just explain to the patient that I'm going to help her with the safety belt and she needs to place a hand on the sliding board so that she can help to push and scoot herself across. Also, to explain while you're doing this that she'll need to, as she slides into the chair, she'll need to reach for the opposite armrest to help pull herself into position. Okay, on the count of 3, I'd like to help you move into the chair. I'll help with the safety belt, and we're just going to slide into the chair, and you'll reach for the opposite arm as you get into the chair. 1, 2, 3. It's usually a very smooth transfer. Get the surfaces as level as you can to make it easier. Once they're safely and comfortably in the chair, she can shift her weight again for me to the side, and this can be just wiggled and pulled out. The final type of transfer that we will be partially demonstrating for you is the transfer that you would use moving a patient from a hospital bed onto either a cart or a stretcher. Now this type of transfer would mainly be done in a hospital setting, and this would be done for a patient who may need to go for a test or go for surgery, and you're not getting them up into a sitting or weight-bearing position. So you're transferring them from a lying down position to a lying down position. With this type of transfer, you need to have the hospital bed, or I'm sorry, the cart or the stretcher flush up against the hospital bed. You need to make sure that you've got the heights fairly even so that you don't have a difficult time moving that patient from one surface to the other. The other thing I want you to be aware of is that these stretchers do have brakes on them. You'll need to make sure that you put the brakes on before attempting to transfer the patient. Make sure that you've got the side rails down before the transfer. You want to just make observation if this patient has got IV tubings or oxygen or a catheter tubing. You need to be aware of where that tubing is so you're not tugging on it or pulling it during the transfer. And when they go for a test, usually all of that equipment goes with them. So you need to make sure you've got it well prepared and you know what you're taking with you. Now with this type of a transfer, you generally will need at least 4 to 6 caregivers to do the transfer depending on the size of the patient. With this transfer, the 3 of the caregivers would stand on the side of the hospital bed or the stretcher. The 4th caregiver would be on the other side of the hospital bed. 3 of the caregivers will need to position themselves so that they are supporting the patient's body completely. The first caregiver would stand at the head where they would be holding near the neck and the shoulders of the patient, and their other hand would be holding down near close to the trunk of the patient. The second caregiver would be standing from the trunk to the knees, and the third caregiver would be from the knees to the feet. What we would be doing is using what we call a lifter sheet or a draw sheet to help transfer this patient from the hospital bed to the stretcher. And the 4th caregiver will stand in the middle of that draw sheet. Many times what that caregiver will need to do is to get either one knee up on the bed or even completely crawl up onto the bed so that she's not straining her back or making the transfer harder than it needs to be, because she'll actually need to be going leaning over and doing the slide this entire distance. What helps is to get the patient as close to the edge of the bed as possible. Remove the pillows so that they don't interfere with your transfer. I'll play the position of the middle caregiver on this side. We would take the draw sheet and make sure we have a good overhand hold on it. Now if you're short like I am, you probably will need to get one knee up on the bed as well so that you're not straining your back. Make sure that you explain to the patient what you're doing and reassure them as you're transferring them. And you would have one caregiver giving the count of 3. And on the count of 3, we would move the patient in one smooth coordinated movement. 1, 2, 3. Okay, when the patient is safely and securely on the stretcher, leave the draw sheet under them so that you can do the same transfer when you take them back to their hospital bed. But at this point, you would replace the pillow so that the patient is comfortable. And also remember, you're going to be transferring them, so you want the side rails up on both sides and securely locked. When the patient would come back from their test or their surgery, the transfer would be the same back to the hospital bed, just in the opposite fashion, with 3 caregivers on the side that will be doing the pulling and 1 caregiver on the side of the stretcher that would help with sliding across.